Good evening, everyone. My name is Franklin Haskins. I'm an academic advisor here at North Central Texas College, and I would like to welcome you to part one of Breaking the Stigma panel discussions. Tonight, this discussion will be focused on mental health in the Black community. Mental Health America reported that approximately 13.4% of the U.S. population identifies as Black or African American. 16% of those individuals reported having some type of mental illness in the past year. That's about 7 million people. Despite the need, the National Alliance on Mental Illness reported that only 1 in 3 Black adults that reported a need for mental health care received it. My hope for this evening's discussion is that we'll learn more about mental health, address misunderstandings about mental illness, and provide our NCTC community, especially our students, with resources that can help. With that, I would like to introduce our panelists this evening. First panelist is Nate Reed. Nate is a North Carolina native who moved to Southern California in 1986. Graduate of Eisenhower High School in Rialto, California. Graduated from San Bernardino College and received an AA degree in psychiatric technology. Worked as a licensed psychiatric technician from 1996 to 2012. Worked at the Patton State Hospital with the criminally insane for 10 years. Nate currently works with Wellbridge Behavioral Health Greater Dallas as the Director of Business Development. Nate has, Nate has been dedicated to saving lives one at a time for 26 years. He enjoys spending time with family members, fishing, and watching sports. Welcome, Nate. Our next panelist is Sadaf McFessel. Sadaf, excuse me, is a licensed professional counselor, supervisor with the director of Family Tree Program. Sadaf has been working with the youth of and families of Denton County for the past 10 years. She is a Persian American who has passion for working with families and countering articulation issues with the family with parents from a different cultural bringing up their children in the U.S. Welcome, Sadaf. Our next panelist is Salee serves as Director of Mental Health Operations for Timely MD. She is a practicing clinician with the experience in inpatient and outpatient psychiatric services, crisis intervention, and clinician development. She has also served as a director of psychiatric services for multiple youth residential treatment centers. Prior to becoming a licensed clinician, she focused her career in an area of human resources and organizational development, servicing aerospace and defense companies. She also served as a consultant to small and mid sized businesses for human resources, organizational development, employee retention, and diversity best practices. Salee has a BA in business management and public relations from Coe College and a master's of counseling from Dallas Baptist University. Welcome, Salee for Kazi. Our next panelist is Tangela Foreman. Tangela LCSW is a therapist for Timely MD. Has been a practicing clinician since 2011 with experience in outpatient, psychiatric, crisis intervention, hospice, and clinician development. Tangela has a master's of social work and a bachelor's of social work from Arkansas State University. She also serves as lead supervisor of local mental health agency in her area. Welcome, Tangela.
Thank you, Franklin, for introducing everybody. My name is Danae Mitchell. I am a success coach for the Completion Center at North Central Texas College. I am also the chair of the Alliance Against Injustices Employee Resource Group. And tonight, I will be moderating this discussion over mental health in the Black community. So, to start things off, I think we can start about some of the language that we use with mental health. So, what are some things or some words that we should use whenever we're speaking about mental health, as well as things that we shouldn't say whenever we're talking about mental health?
I can get it started. I think there is a clear, there's some clear stigmas around mental health still. So we're always dealing with those. I think one big thing to remember is that we're talking about holistic wellness. I think that's a good phrase to use, is holistic wellness. It's mind, body, and soul. Like, how are we taking care of our bodies, our minds, the people around us, ourselves? How are we promoting health in general? And I think as a community, that's a great conversation starter. Not just diving into mental health and if somebody is well or not mentally, or stable and not mentally. One of the probably no words is, what is normal? And I think that's one that usually can cast some judgment on someone's situation. But if we're talking about holistic wellness and what it means to be well, then that opens up the conversation to everyone. That starts to normalize that thought of, what does it mean to be healthy? And healthy can also include, just like we think about our bodies, healthy can also include our mind. So I think those are some good ways to start, normalizing the conversation around mental health, is to also embody the idea of wellness, holistic wellness.
Yeah, I really like the idea of thinking about it as a whole individual. It's not just mental health, it's not just physical health. They all impact each other.
They do.
Does anyone else have anything to add to that?
I think one of the things that we try to steer clear of is some of that old language of calling it like mental illness. We want to just be more careful about how stigmatizing that word can sound. And I think how we can destigmatize it is by having these kinds of conversations, not being afraid to say mental health, not being afraid to say, like, we need to talk about this, and that this is part of your wellness. It's not just about how is your heart doing, it's also about how is your mind doing.
Yeah, I think that's a big thing with destigmatizing it, talking about it, and normalizing that everyone goes through things.
Mm-hmm.
Yeah, I think having the dialogue is the most important part, is to at least get the conversation going. Years ago, especially in the Black community, no one wanted to talk about any type of mental illness, especially within the family. You certainly didn't want to be seen at a psychiatrist, with stigma, of course. And if you were seen, then you'd go to a primary care physician rather than a psychiatrist, just because the stigma wasn't there for going to a primary care physician.
And another thing is just being okay with, a lot of times growing up in Black communities, we were told what goes on in the house stays in the house. So you weren't free to talk about your feelings. Get away from that. Being able to just open up about your feelings. And so just having that conversation.
Yeah, I think the conversation is really important, and giving yourself permission to have those feelings and talk about those feelings is really important too. Especially there is a lot of stigma in some upbringing. I can remember hearing, like, you don't talk about our business outside other people. So yeah. So with that, the next question is, what causes mental health problems? And is it something that people will always live with?
Well, I'll kick it off. There's a lot of factors that cause mental health problems. And so one being genetics. You know, a lot of times if someone in the family is diagnosed with a certain disorder, it's very likely that someone else in the family could be diagnosed as well down the generation. Another factor, of course, is having stressful situations in your life. Alleviating stress is a big factor as far as having a good mental well-being. Another factor is the holistic approach. Like Salee said, it's you have to have a mind, body, and soul approach. And if you're not taking care of your body physically, it's very hard to mentally stay on top of things.
I'll piggyback off of what Nate said. I think, understanding that several things can contribute to people's mental health. Your living situation, your level of stress, your work, relationships, everything plays a part. And I think once we start thinking about our lives, not just, in singular ways, but when we start to adopt that idea of like, I want to be well in general, then we start looking at areas of our life. Mental health problems can arise when we're not, setting certain boundaries. And like Nate said, increasing a level of stress within relationships can be from a lack of boundaries, not creating some balance between work and home can lead to some stressful situations. And those stressful situations and high rates can turn into burnout. It can turn into feeling overwhelmed and stressed, and then possible depression. I know what I've seen as the platform that I help direct. We've understood that most of the students that we see are saying that they feel overwhelmed, they feel burnt out. Over 60% say that they have had issues with depression and stress and thoughts of harming themselves. Like those things start to spiral. I like to call it, when I'm talking to students, I like to call it the snowball effect. So those things that just start to build up, and the next thing you know, it's bigger. And, when a snowball gets so much bigger, sometimes the middle is filled with ice. Then we have other issues going on. So I think of mental health in that way too. It can kind of just build up and spiral out of control, even without people really thinking about it. But if there's a level of feeling overwhelmed and burnout, and we're not paying attention to these other areas in our life, they all start to come together. And that's when someone presents and says, okay, I feel like I'm having a breakdown, or I feel like I can't handle the stress. I just want to hide and run away from everybody. And those are certain things that we start to listen to now. I think, friends and family members are listening and paying attention now to some of those key words and phrases that people might say to give us a tip that they might be in some level of, mental stress or strain and could possibly be in trouble.
I'll speak to if it's something that you have to live with for the rest of your life. In some cases, yes. I think in some cases, when we talk more about like the biological factors, sometimes it can be something that somebody works with their whole life. And I don't say like works through or, struggles with. I mean, you just learn to live a life with it. But I'd say the vast majority don't live lifelong with mental health issues. If they embrace wellness, if they embrace setting, like Salee said, if they embrace wellness, if they embrace setting boundaries and putting their needs ahead, then frequently those symptoms go away. And once you've learned how to manage your stress or life or all of these different things, then you're no longer struggling with the mental health issues.
So I think our next question kind of piggybacks off of what you said, Sadaf. Can you prevent mental health problems? Or can you cure mental health problems?
I think knowing your family history can help you prevent some of the different things that come along with the genetic things that's going on, curing mental problems. As she was saying, that you're not going to always suffer through, you're going to learn how to manage it, how to cope. What do I do in this instance, and what do I do in that instance? Life continues to go on, so you're going to have different things that come up in life. Like, you're going to have things that's going to cause you to have anxiety or have depression. But what do I do in that moment? And learning what to do in that moment helps you to manage it.
Yeah. In addition to that, I think the more experienced you get at it and managing these stressors, you get even better at it. You know, you can do it faster and more frequently in managing stressful situations. And you also notice when to set those boundaries. Again, you know, boundaries are a big important tool as far as you know, avoiding all the stressful things. So I think all that stuff counts. Also, I think when it comes down to mental illness, basically, there's really certain disorders. There's no cure for it. You can treat the symptoms, but you absolutely can't cure some mental illnesses or mental disorders. You can't cure some of them. So, but you can alleviate symptoms in different ways. By, you know, it will go over some of those. I don't want to skip to any of the other questions.
So the main kind of thing that I'm hearing is like, it depends. But also it's something that can be managed kind of similar to like other physical conditions that we have. So like if somebody has asthma, they learn, okay, these are the things that trigger my asthma. So I'm going to find ways to either manage it or cope with it. And it's kind of similar with mental health too.
Right.
Exactly.
Right. Okay. So our next question is, how do I know if I should be concerned about my mental health?
And it starts to affect multiple areas of your life. And so a lot of times I'm seeing students being not able to cope with just being by themselves. Those are developing relationships. So they're having more depression and different things else like that. So now it's not only affecting them personally, but now it's affecting them being able to communicate with others and different things else like that. And so, which in turns into anxiety and more depression. So when it starts to affect more areas of your life, more than one area of your life.
I think Tangela brought up a good point. When we find students or encounter students that have trouble, being by themselves, coping, things like that, I also look into the times when they're having trouble adjusting to new situations. So those adjustments can bring out issues that they might have not known or recognized before because you're in a familiar setting or surrounding and you're not understanding. So we have a lot of first-year students who use our services well over, the amount of someone who's already settled into a college or university, and they feel comfortable, they have friends, they have connections. But COVID has changed a lot of that for a lot of our students. That ability to connect and build community has really thrown them into a tailspin. Some of them said that they felt overwhelmed and burnt out before they even hit the classroom in the fall. I also saw numbers on my side, just the number of students that were reaching out for help or support nearly quadrupled. So prior to COVID, we had about 10% of our base of students that contacted our platform were about mental health, about 10%. The rest was all medical. After the pandemic and prior to and in the middle of the pandemic, we went up to almost to 70% of all the platform touches were for mental health. So that just lets us know that students if this in this population, students are reaching out for help, they're noticing the changes, but it's also taking some self-evaluation of your surroundings, your life, and telling yourself the truth and being very honest, even when it's hard, to say, okay, something's not quite right. Or noticing with someone else that something's not quite right. And I think I might need to talk to somebody. I'm not feeling the same. I'm not going to lunch as much as I used to. I'm not going to the movies or calling people as much as I used to. Things are changing, like Tangela said, in multiple areas of your life that are causing either, other people to ask questions, or for you to start kind of reflecting and asking yourself some questions that this isn't how I would normally function. And so what am I feeling? What am I thinking? And do I need to talk to someone about that? And it's okay to reach out and talk to someone about it. It's not detrimental. It's sometimes just a temperature check. It's like we said before, if there was a medical issue, we would try to get a checkup and see exactly what was going on. So we're not going to let something get out of control. But I think with mental health, it's the same thing. If we start to see different areas of your life being altered, feeling sad more than normal, feeling lonely more than normal, or not making some, connections as far as relationally as normally as you would, those are times to start taking another look at yourself, your surroundings, and possibly what help you have access to make sure that you can evaluate the situation a little better and not just be your own resource. I tell everyone it's okay to ask. It's great to ask, but when you become your own consultant, that's a bit of an issue. Some other people involved, and you never know, you could be helping someone else out tremendously just by bringing it up or asking the question.
Anyone else want to speak to how somebody might know it might be time to reach out for help?
I think Salee covered it very well.
Yeah, I think one thing too that you mentioned is that it's okay to ask for help. I was reading somewhere, and it was specifically about African American people, but a lot of times whenever they were struggling and they felt like, hey, I need some help, they viewed it as a sign of weakness.
Right.
And I think whenever we start to think about our mental health when in the realm of like health, so like if you're coughing, well, you're going to go to the doctor to see why you're having a cough. You're asking for help. Even students, like if you're struggling in a class, you'll reach out for help to help you with the paper. And it's kind of similar there too.
Definitely.
Okay, so the next thing we have is what things help manage mental illness or mental health concerns. And I have on here to talk about medication, but also just other things outside of medication too.
A good way of coping, exercise. Meditation. A lot of times I do guided imagery with the students, relaxation techniques, just walking them through and showing them how to relax. And asking yourself, a lot of times I get a lot of students with anxiety. And it's, if we sit around and worry all of the time, it's not fixing a thing, nothing. And it's just increasing your anxiety level and stressing you out, which is going to cause even more things in the long run. So allowing yourself to just relax. And sometimes we're walking through people through that, but a lot of times you can find a lot of stuff on YouTube to just, okay, what should I do? Can I get a meditation thing? Can I get a relaxation thing? And so those simple things go a long ways. And just asking yourself whether or not, is this something I can control? If it's things that you cannot control, allowing yourself, giving yourself that permission to let it go.
I think even taking like an even broader approach to it. A lot of times I'm asking clients, how's your sleep? Are you sleeping Sleeping too much? Are you not sleeping enough? What's your eating looking like? Are you eating? Tell me more about how you're feeling really tired, or you're feeling really anxious, but that's your blood sugar is also dropped for the day and you haven't eaten in 6.5 hours. And so really taking a step back and thinking about some of those basic things that are seemingly easy to address. But I mean, we all know we've all had sleepless nights and those don't feel easy. But really trying to say, like, are you going to bed at a normal time? Are you waking up at a regular time? Are you showering and doing some basic needs help, healthcare things for yourself? Because sometimes just doing those small things, getting back on some sort of routine, can be especially helpful, especially for students at this age, because they're kind of doing it all on their own for the first time, and they're like, let's throw all caution to the wind. And some of that is so fun, and they should definitely do that. But if they're finding that they're feeling lost, sometimes going back to some of that routine can really be helpful.
Mm-hmm.
I'll kind of piggyback off of both of you. I think the idea that sometimes students get into the thought that they want to incorporate pharmacological resources, medication management into their mental health regimen to make sure that they're doing well. I get some students that are super focused on, I just need medication. That's going to be the answer. But what we just heard is just that there's all these other factors that are still going to be involved, even if you do introduce medication. So we're still tracking sleep and eating and relationships and exercise and understanding how are we really incorporating these things in our life to enhance what even medication can do. So I'm not saying not to take medication. I think it's very appropriate for a great deal of cases, but there's also those times where self-care can mimic what a possible medication can do for support. But until we're able to get into those routines and take care of ourselves, sleep well, eat well, that medication could be a great help. But then, it may not be, I get a lot of students who are concerned, am I going to have to take medication forever if I get started? Absolutely not in some cases. Some cases, like Nate said, yes, we're going to have to manage this your whole life. But in other cases, there's times when, just taking care of yourself can also give you some of the relief that you're looking for. If we start exercising regularly, eating regularly, sleeping normally. I think I remember being in college and I'm up at 4 o'clock in the morning, living a normal day, starting at ending at 3-4 o'clock in the morning. So if there's some, then I'm feeling tired, upset, maybe you get sad when you're exhausted, your body starts to feel differently and work differently. And just being, in and out of psych hospitals as a clinician, I noticed that one of the very first things our psychiatrists ask for our patients to do is to make sure they get some sleep before they even will evaluate them. You have to get a decent amount of sleep before you'll even go through an evaluation. So that just speaks to some of the simple things, but like Sadif was saying, that there are other. These are things that are so important. They seem simple, but they can really throw off anyone's, regimen. And it can even throw it off if you do have medication involved. So it's something we need to pay attention to on a regular basis, just to see if that can possibly help and support in some way. So I think medication management plays a big part of that holistic wellness for several people. And if medication is not being used, then there's still those key tools to use to support our mental health overall.
Yeah, it sounds like regardless of, if there's medical intervention or not, it's still going to be important to take care of some of those really basic things like sleep, eating, and moving. I do know that there can be a lot of fear around taking medication to help with your mental health. Can anybody speak a little bit more to to people that might say, I think this might be something that I need, but I'm scared?
I can. Well, when it comes to psychotropic medications, when I first started working in psych, we were on first generation psychotropic medications. Now they have new medications that cause way less side effects. So back in the day, a lot of people were afraid to take them because it caused things like tardive dyskinesia, dip tremors, different things that it would cause. In addition to it can make cause weight gain. And that was a major problem as well, because some of those medications were causing patients to get diabetes. So with all those factors that are involved in that, it made patients very reluctant to try that medication. But again, there's a new generation of medications that do not carry that same amount of side effects. So that's one factor of the medication. Another factor is this goes along when a person is depressed and you're being medicated for depression. People will take the antidepressant medication, which it already takes 14 days or so to even take effect to where you actually feel anything from it. And then once I'd say they're on it for, it all depends on the time frame for everyone, but you start feeling better because the medications are hitting the right receptors in your brain and it's making you feel better. And oftentimes people just say, hey, I'm cured, I feel better, and I just want to stop taking the medication. And they stop taking it, and then it's a downward spiral after that because the medication levels go down. You have to build them back up to another level, and it causes a lot of depressed and irritable type feelings, as well as affects your appetite and your sleep pattern. So medications play a major factor, and I can see why people could be reluctant, but again, these medications these days have much less side effects, as well as you have a lot of ability to research the medications that you didn't have the ability, before Google and all the search engines. You just could not find out about all the things you can right now. So I encourage everybody who feels like something isn't right, if something's going on, to do the research, but don't self-diagnose.
And I want to say just one more thing is that you're your own advocate in this category. So if you choose to pursue medication, and you should have a follow-up appointment 14 to 21 days after with the person who prescribed it for you, so that you can talk about how are you feeling, how is your sleep, how is your appetite, all these different things. If you don't feel right, it's not just that is the only option of medication for you. There are a million things that can be tweaked, dosage, different kinds of medications. So all of these different things. So I think a lot of times people say, oh, well, it didn't work for me. And they tried it and they only did it for 7 days. It hasn't even reached that point. So just making sure that communicate with the doctors, talk with them about what you like, what you don't like, and they should be able to help you get to your sweet spot. But really you have to be your own advocate in that.
Yeah, I think that's really important to remember too, is to speak up and to explain how you feel, explain what's working, explain what's not working. So the next part of our discussion is going to be more focused on issues related to mental health in the Black community. So my first question is, are there any ethnic or racial groups that are more likely to experience mental illnesses?
Well, according to psychiatry.com, I have some statistics here, which says that adults with 2 or more races are reported to have 17.1% cases. White adults is 16.6%. American or Alaska Natives are 15.6%. Black is 8.6%. Hispanics are 7.3%. And Asians are not 4.9%. But that's only speaking for overall. that doesn't specify and break it down into the different disorders. So, but those are the statistics.
I would have to say I think those are those good overall numbers. When we're looking at it also at a high level, I think it's also important just because of the exposure of our society today and the things that we're dealing with. I think we've seen an increase. I know like I said earlier, like if we have students that are reaching out now, and the numbers that I've seen from this year, from last year, have more than quadrupled in just a year. That was alarming. When we're pulling out stats and understanding who's utilizing and how they're utilizing, we're also paying attention to socioeconomic backgrounds, the conditions that people grew up in, exposure to just mental health literacy overall, understanding that a lot of students the students that I deal with are navigating care on their own for the first time. So they're curious. They might have come from backgrounds where there were tremendous amount of barriers to them receiving mental health support. So just culturally not acceptable, or in the family or culture that they're in, it's not something that was readily available to them, or maybe even forbidden in some cases. But when we start to destigmatize and break down the barriers and provide equitable access to care, then we're starting to see that people from all walks of life, varying different socioeconomic backgrounds, people that you wouldn't have perceived to possibly have mental health issues, are now coming out of the woodwork and wanting the help, accessing care. It can be done in private. It can be done on your phone. No one has to know. There's all these factors, I believe, that have not just affected have not only just affected minority communities, it's affected, cultures across the board. So I think those numbers are very poignant, and they're on point. I believe that what we see sometimes also is just some of the barriers that stop people from getting the care. And I think in certain communities, the barriers they're just more barriers to that care, and there's more stigma associated. And so there's times when people are going years and lifetimes without the support and the help that they need. And then we're seeing, those exacerbations in our society of people not getting the care and not getting the support that they need. So the education, the literacy around mental health is really where we start to target. I think the sad part is sometimes the people that need it most don't have the access. And that's one thing that Timely MD has been really conscious of, is understanding that, providing that access is the number one important thing that you can do. The education and the access is really what people need.
Yeah, I agree. There's certain communities are really under-resourced. In addition to that, I know when it comes to inpatient treatment, the insurance companies really dictate a lot towards how much a patient can get to receive treatment. And what I mean by that, and I mean, they don't totally dictate it, but when a patient is in crisis, and we're all different. It may take me 14 days to snap back, and it may take you guys 5, 7, and 10. But the point is, everyone is different, and there's no cookie cutter to mental health treatment, and everyone is an individual, and everybody it takes different treatment. It takes different dosages, medication adjustments, dealing with different situations that actually is the root cause of the problem. Those are the things that could cause the treatment to take longer, and insurances oftentimes dictate how much they feel like the patient should receive, how many days of treatment. So that's a big factor, as well as, I know this is a totally different demographic, but for senior citizens, Medicare only pays for, they only treat 190 days of lifetime for psychiatric services, which is really sad, because you can exhaust those days by the time you're in your early 60s. So it's really unfortunate, the type of pull that and they're under-resourced, basically, is what it boils down to, is just being under-resourced.
So Salee, you said something about mental health literacy. How can people become more mental health literate?
Well, I think we've all kind of touched on just what we have access to now, even just simply the internet. We can get more information, finding providers that you trust. Having a conversation with a psychiatrist, that's important. Making sure you feel comfortable with the counselor that you've picked out is important. Those are great resources for asking questions and digging deeper, not only into yourself, but then, getting a better idea of what's out here and what's available for help and what's available as far as resources. There are so many, like Tangela said, there's even YouTube videos that will, from board certified psychiatrists. I know one of the psychiatrists I work very closely with, he has actual informative videos on YouTube to help people understand, okay, this is what depression is. This is what stress is. This is the difference between burnout and caregiver burnout. What does that look like, and how can you help support yourself? What does medication management look like? But there's so much information at our fingertips, understanding where to go, definitely vetting it, making sure it's credible, and you see the resources are valid resources, and then bouncing that information off of somebody that you feel like is a trusted professional that you can access. Even at schools, if you don't feel comfortable just getting out here in the community, finding a provider, finding a counselor or a professional from the school, or somebody you trust that can recommend someone for you to talk to. Getting access to education about mental health is now more accessible than ever. I think one of the major things that I've appreciated about our company focusing on some on-demand features, like before a student ever gets to even taking a scheduled session or using one of our on-demand services to talk to a clinician, but maybe you just need to go online and look up what stress or depression is and get an idea for what the parameters are. If I was sad for one day, I may not have major depression. I may just be sad for one day, but if it lasts for 2 to 3 weeks, we might, there's something going on with that. I stopped taking showers. That's something different. So just starting to get acquainted with some of that information, go to reputable websites, the APA, go to NAMI, and understand what the thought leaders in this field are talking about, and then what's easy and accessible. There's so many on-demand quick resources. I know a lot of our students aren't going to sit down and watch something for 2 or 3 hours, but even the videos I talked about are 5 minutes or less. And getting that information from quality, reputable sources is a great way to increase your mental health literacy. The information is out here, it's accessible, and a lot of times the videos are short. So we can get the information we need to point us in the right direction. And then don't be afraid to incorporate somebody that you feel like has some quality, that could give you some quality input. It could be a counselor. It could be someone that, I had a friend one time tell me she couldn't afford to go to a lawyer. So she knew a friend that's a lawyer, and like, hey, what about if I were to tell you about a situation, and it's okay to ask questions, is all I'm saying. And when you have someone that might be in arm's reach, go ahead and reach out and ask for a friend, not for yourself. And they can help point you in the right direction also if you're asking for a friend too, even though you are your friend. So I just think there's so many ways that we have access now. Just getting that information is key.
All right, thank you. So the next thing I want to kind of explore is, as clinicians, do you approach people from different backgrounds in different ways? just kind of curious on how that experience is for a clinician and then somebody that is receiving therapy or receiving services.
I think it's very important that you be culturally competent. And if you don't know the culture, get to know the culture. Getting that understanding. A lot of times I get a plethora of different nationalities and different people, and they're international students and they're American students. So you never know where they're coming from. But getting to understand their culture or just by simply asking. And then you know what approach works better for them. So being able to relate to them on their own playing ground makes it a lot easier for them to just open up to you, because you're not coming off the top of your head of this person, your own biases. And so being self-aware of your own biases. And so that's where I come from as a clinician when working with just different individuals.
Yeah, I think it's our responsibility to always strive to understand our clients, because just because we might share the same cultural background or ethnicity doesn't mean we have the same experiences. So in the room, it's our job to make sure that we understand exactly where our client is, where they're coming from. If we don't know, just like Tangela said, we ask. If you are in seeing somebody and you don't feel like they're doing that, or they are coming in with their own personal biases, it's time to like run and go somewhere else. So, I mean, seriously, it goes back to that advocacy piece of, if you're not getting your needs met clinically, then it's okay to just go somewhere else.
Right.
I mean, I think let's talk a little bit more about that. So if you are working with a therapist and you know, it's not vibing out. Tell me kind of what conversation or how somebody might advocate for themselves in that situation. So it's like, hey, I'm not feeling like you're really listening or hearing me. Is that something that you would talk to your therapist about or your clinician about, or do you just like run for the hills?
Some do.
All of the above.
Some people are very open.
Yeah.
And I always describe therapy in the beginning like going to a grocery store. So you might have the same product and you just like that brand a little bit better. So you might like Green Giant brand over the Walmart brand. But they're all therapists. And so you're going to vibe with some therapists, and some therapists you're just not going to vibe with. And so just being open and honest. If you don't feel like they're meeting your need, you can. Some people like to tell them, then some people just like to go. No, but just just do it on your own. We will not feel bad about it. Believe me, we will not.
I think it goes back to that advocacy part of it. Like there's some times where you have to speak up. And I am all for, running for the hills and not telling anyone, call the admin and cancel all your sessions and find somebody that is going to work for you and work with you through the issues that you need to address. So I would say to anyone, especially, especially students, because sometimes that's a hard space to be in for the first time navigating care on your own. And now you have to advocate for yourself. Now I have to fire my therapist because I'm not vibing with them. Like that could be a lot. And we don't want, what therapy or counseling should never be, is stressful. Right. That shouldn't be the stress. Your concern for their feelings over yours, that's not the space to do it in. And I believe anytime that you feel like it's not okay, you can go ahead and just, if you don't want to go into the office, just cancel with the admin. That's okay. and make sure you actively find someone else. Or you can even take recommendations from other people or referrals from other people that they might have had a great success with a certain therapist or certain office that has a group of therapists that you feel comfortable with. That's a good option too. Shopping around is not a problem. The goal is to make sure that you're well and you have somebody that you connect with. And just like Sadaf said, even culturally, just because, you look like me I may not be the best, therapist for you. So being culturally competent, that's something you should expect for the provider to be professional. Yes, you should expect that. But if you're not able to check off those boxes, do not sit there for 12, 13 sessions out of obligation to a therapist. You advocate for yourself. And if you can't do that, I guess I just condone ghosting a therapist. So basically, however you have to find the right help for you is really what you need to do. And don't, like Tangela said, do not feel bad about it. It's about getting the help that you need.
Thank you for that. Not ghosting your therapist.
I think that's almost what it is. I had a student tell me that they had to one time, and I'm like, it's fine, and I can help you find somebody else. That's what the help is there for.
Yeah. So next question is, and I'll start off with a statistic that I read earlier today. It said that 33% of Black people with mental illness sought help from mental health services, which I guess I'm wondering what some of the barriers are that you think may block African American Black people from reaching out or receiving mental health services.
So one study I was reading on today, it was saying that 63% of Black people believe that mental health condition is just a sign of personal weaknesses. Is that many people choose to seek support from their faith community rather than seeking a medical diagnosis. In the communities in the U.S., the church, mosque, or other faith institutes can play a central role as a meeting place and source of strength, and just the stigma behind it. A lot of times it's looked down upon. We sweep a lot of things underneath the rug and we don't talk about it until it kind of surfaces where everybody's seeing it. And so just those stereotypes, it's getting away from those things.
Yeah, I've also seen situations where you have inside the house, like I think Tangela said it earlier, that nobody wants to talk about it. Like it's almost like something's wrong with this family member, but it's almost like they normalize it within the house and not seek help for it because of the stigma. But it's almost like they sweep it under the rug or seem like it's a normal behavior when it really isn't. But you get used to it. I'm just saying from that type of setting, I've heard that from so many people that, Uncle Mike has been doing this for so long, but that's just what they know. They've known him to be that way since he was a kid, right? Or since they were kids. So, yeah. So I think too many times people just normalize it and not really reach out or ask them if they're okay. Like, I think it's okay to go straight up to someone and ask them, are you okay? And how do you feel? That's the way it is nowadays. It's okay to do that. You're doing that person a favor. Mm-hmm. Yeah.
So with that, what do you think some things we can do to help break down some of those barriers to start removing some of that stigma?
I think not being afraid to start the conversation in spaces of, I've seen it almost in some communities be, therapy is more glorified in some areas. I remember being in communication with a student and they were like, oh my gosh, finally, I was able to get a therapist. All my friends had therapists and I was the only one that didn't. And we because we didn't have insurance. And I sat there and thought, it's kind of funny at first, but the idea that in some communities, like that's almost a badge of honor. Like we could afford therapy. I can go to therapy. It's cool. Everybody I know has a therapist. We almost need to get to a space where, that's the conversation. Like I tell anyone, I'm definitely a proponent of, as a clinician, I'm a proponent of clinicians having a therapist. If you're a great clinician, I think you should have somebody that you talk to. It may not be every week. You may not have the time for it, but it may be on a quarterly basis or something. Like just making sure that you're having that mental health check-in, even as a professional, and normalizing it from even that standpoint. I think it starts to say, okay, this is okay to do. More people need to be okay with sharing a little bit of information. If you're in leadership or if you know that you're influential in a circle, bringing up the conversation, making sure that not just you are okay, but the people around you are okay. Like Nate said, ask someone if they're okay. Or I've noticed this about you. Have you thought about getting help? Or this is something that, could help you. And if you need my help getting to the space that you need to, how can I be of assistance? But having that conversation is really the start. I almost think it's better to be in a space at one day where it's a badge of honor. Like I have a therapist, and this is great. Like life is better. I love talking to students that are like, oh no, I have session on Thursday at 4:00. I can't wait. I cannot wait to tell my therapist about this. So it's a great thing. It provides a level of self-care. It's part of self-care. It's part of balanced living. It's part of decreasing a level of internal stress and pressure. And everything that leads to that decrease in internal stress and pressure overall can help us, live a life that's happier. We can live a life that's more relaxed. With a relaxed body, you can approach life from a relaxed body, which means you're going to be nicer to people. You're going to be able to think better, sleep better, eat better, everything. So it should be, normalized, and people have to start the conversation wherever we can. Have the conversation.
I think that's a really good point, because sometimes it might come off differently if it's somebody that you don't necessarily know or respect, saying, hey, you should probably go to therapy. But if your friend says like, hey, I went to therapy and it helped me, maybe you should try it. And even just allowing yourself to be vulnerable enough to share that you went to therapy and that it was helpful for you can make a huge difference. So I think we kind of touched on this in regards to insurance. But one of the questions that we have is, if finances are a barrier to getting counseling. Number one, is there resources that we can utilize? And also, why is it difficult to get medical coverage for therapy or for mental health services?
Well, every county has a mental health department or system that oversees the mental health cases within the county. And there's a division of it that you could go to if you do not have any mental health coverage or insurance. And they will pay, if you need an inpatient stay, they pay a big portion of it. I can't say they pay it all, but they pay a really large portion of it. So in particular, in your county, it's Denton County MHMR is what it's called. And don't ask me what that acronym is for either. On this mental health, I'm sorry. But anyway, it's a great resource for anybody. So if anybody's listening and you do not have coverage for mental health resources, look for Denton MHMR, Denton County, and they will take care of you. They'll make sure that you are getting to the level that you're being met at the level that you're at. which
those,
is, oh, go ahead. Sorry.
is that available in other counties? Do they have that for Cook County?
Yeah, so in Cook County, it's called Texoma Community Center. And in Collin County, it's called Life Path Systems. So those are the organizations. And in Dallas County, it's called North Texas Behavioral Health Authority. And those are the places that will help you get coverage. And if you need inpatient, outpatient treatment, it's a good resource.
Thank you.
Yeah.
Say if you live in the North Texas area, UNT and TW both have community clinics that they accept community patients. I know they go as low as $5 to $10 a session. Sometimes that can be helpful, but it is a systemic problem that we in the mental health field are very aware of, that it's not as accessible as it needs to be. Talking back about what Salee said, it becomes a status thing. Like, well, I have a therapist. It should not be a status thing. That is a bigger problem. We need a lot more advocacy to try to get more healthcare benefits for those who have insurance, and then to make sure that those who don't have insurance also have access. Yeah, it's a bigger problem that we don't have all the answers to just yet.
I think one of the things that I've found is that with the company we work with, being able to provide access to care without students having to pay money for it up front, that's decreased so many barriers for so many students. Understanding that it's free. They can, I can use these sessions, I can access care, and I'm not being charged. That means I don't have to call home and ask my parents for money. I don't have to even ask their permission to get the help, which sometimes also decreases another barrier, removes another barrier for them, because they may not have come from a household or a culture that would promote it. So I think there's so many ways, like Nate and Sadaf have mentioned, is, there's so many other resources. And that's the one thing I could just talk all day about, is just removing barriers and for care. I think also you got to think outside of the box sometimes. If you're not, attending a school that provides a free service like that, or you want to use a community resource, there's also clinicians that may not advertise it, openly, but they have sliding scale systems where they'll accept less for a certain amount of clients, and they don't have to charge full price. And so they don't. There's some that are not, or within the faith-based community, at churches, that may offer services for absolutely free, but they're licensed clinicians, and you can get the same quality of resources, but maybe for only a donation price or an offering price. And that's also something to look into. I know that's been a huge resource, especially in Texas, that there are some faith-based communities that provide not only faith-based counseling, but all types of counseling, but just through organizations that offer it for free or low cost. So that's also something to think about, is thinking a little bit outside of the box. Or if you find a clinician that you absolutely like and you feel like you might be able to make a connection with them, tell them your situation. That's part of advocating for yourself too. You might be able to talk to them and say, hey, listen, I see your price is whatever it is online. However, that's not my budget right now. I was just wondering if you were accepting any clients on a sliding scale or for a reduced amount. And you never know what they might say. I've heard several clinicians, I know myself, even when I was in private practice full time, there were definitely times where I was like, you know what, that's okay. We can work something out, or they can, set up a different system for you. And that's completely okay. Within the helping community, that's how you can kind of tell too who you're working with. I mean, sometimes people are willing to do some things that are outside of the box to make sure people get the care that they need.
Thank you all for sharing those different resources. Um, before we close, I wanted to ask a couple more things. So, are there specific sites online that people can go to find therapists? I know there's Psychology Today, which is pretty common, but is there any other website that you might recommend? Or if I know some people look for people of color to be their clinician, are there any sites that you would recommend there?
I was on NAMI site, and they had a whole slew of Black mental health resources. There's Black Men Heal, which was a limited and selective free mental health service opportunities for Black men. And there was a whole list of different ones that was on that website. Right, so NAMI is the National Association of Mental Illness.
Alliance. It's
Alliance.
Yeah.
Yes, Alliance. And thank you. And,
You're welcome.
and that's a very reputable website. So going on there and looking up those Black resources and looking through it to see what all is there. And some of those are search engines as
Okay.
well.
So it's NAMI, is it NAMI.org?
Let me.
I think it is.
Yeah, I believe so.
And then Mental Health America, they usually have some good resources as well.
Yes, it's NAMI.org.
Okay. All right, thank you. And last, I know you all are working for your clinicians at different places. So I wanted to give you all an opportunity to share where you work and how they impact our communities.
So I work through Timely MD. And so I do a lot of Talk Now. So it's like a therapist on demand. You always have a licensed clinician on the other end just for additional support, where we get some of everything. And then sometimes we're referring people over to counseling if it's something that needs to be worked on long term. But just know that I know your school has it, but we're just here for additional support. You can contact us at any time. It's a 24/7 service. So even at 3 o'clock in the morning, there's going to be a therapist on the other end. And so it's something that I have fallen in love with because I get to know a bunch of different students from a bunch of different backgrounds. And it's just something that I love to do.
Well, I'm glad Tangela started it off. So I'm the Director of Mental Health Operations for Timely MD. So we are the leading virtual health and well-being solution for students in colleges and universities. We provide scheduled counseling. We provide on-demand support for students with licensed clinicians. We provide also psychiatry services, medical, and health coaching and wellness services also online. So the greatest part about it is free to students where we service their schools or universities, and they don't need any insurance. All they have to do is register. Another great part to it is that we've been talking about, is decreasing those barriers. So with it being virtual, they're able to use it on their laptops and cell phones. Being with this organization has definitely opened my eyes to some of the increasing needs of this specific population, regardless of socioeconomic background, culture, ethnicities. There's some things that are just universal to our higher education institutions, and just being able to serve these students has been amazing. I second what Tangela said. It has been it's wonderful. It's a great honor to be able to come in and walk alongside people that are individuals that are kind of getting into life and figuring things out and welcoming solutions. So that's what I do for fun is is work with Timely MD.
Now, is Timely MD, are you guys offering virtual only, or is it brick and mortar also?
Virtual only.
Virtual only.
Mm-hmm.
And it's for students, not adults, correct? I know you said it's free for students.
So I'll say this. I'll put in a plug. I was gonna save this, but I'll go ahead and put in. So all current NCTC students have access to Timely MD. So if you're a student at NCTC, whether you're 18 or you're 118, you have access to Timely MD. So you can see at the bottom of the screen, there is a link for it. So basically it's nctc.site/timelycare. And that will take you to the website. So check it out if you feel like you need it. There is an app for it. I encourage students to download the app because what you probably don't want to do whenever you're not feeling great is fill out a bunch of demographic information. And it's still kind of like a doctor's office, like if you would go to a brick and mortar counseling session, they're going to still ask you for some demographic background information. So if you fill it out now, and then you need it later, it's one less thing to slow you down.
Yes.
So.
And we get a wide range of different people, different students, ages, adults, and everything else like that.
Okay.
And I'll also add our part-time employees at NCTC also have access to Timely Care as well. So I know Sadaf and Nate, y'all are working for great places too. So I want to give y'all an opportunity to share as well.
Want to go first, Sadaf?
Sure. So I work for a state-funded program that targets youth and their families. So we're really intended to help prevent child abuse and neglect, kids from running away, kids from skipping out on school and entering the juvenile justice system. We practice from a family systems perspective, so we try to involve the caregivers as much as possible, because one thing that we've learned about youth is that you can do all the work you want to do with the individual, but they still have to go back home. So if we're not helping make changes at home too, it's not setting them up for as much success. So that's what my program does.
All right. And my name is Nate Reed. I work with Wellbridge Behavioral Health Hospital located in Plano. And we provide inpatient and outpatient services for adults and senior adults. We will be soon doing a partial hospitalization for adults, and we're also opening up partial hospitalization and intensive outpatient programs for adolescents. And that's probably going to open up around, we're having a brand new construction on a brand new building, by the way. I forgot to mention that. That's very important, because everybody likes being in a new building and all new stuff. So it's going to be beautiful, as well as some great staff now. That's the most important thing. So with that being said, we provide services. We accept almost all insurances, commercial insurances, Medicare, pretty much all insurances. So if anyone's feeling not themselves and you need help, you don't necessarily have to call Wellbridge, but certainly reach out to someone and get some help. I thank everybody who joined in on this right now, because this is a great platform, and I'm just thank you for inviting me as well, and just happy to be here to help on anybody that needs help or possibly with mental health services. Thank you.
So I just want to take a moment to thank all of the clinicians and everybody that's here today to talk about mental health. I really appreciate your your insight, your advice, your resources that you shared today. I also want to give a special thanks to Daisy Garcia, Jacob Arnold, Kara Morgan, and the marketing team at NCTC for helping put this all together. And I want everybody to remember that mental health is health. Remember, taking it as a holistic approach is really important. So it's just as important as you getting enough sleep, eating healthy foods, exercising. It's one other aspect of it. So make sure you're taking care of yourself. And if you need help, don't hesitate to ask. You can reach out to somebody at NCTC. We can refer you to our timely care or other resources that might be beneficial to you. But I hope y'all all have a great evening. Thank you.
Thank you.
Thank you.